I've posted this video to salute patients with pain, as well as those caring for them, during Pain Awareness Month. In recent years, my predecessors have selected one or another aspect of pain to emphasize during their terms. As a professor of public health and community medicine, I want to emphasize that pain and its treatment, including the unintended consequences of its treatment, are public health issues. What does it mean for something to be a public health issue? We know that a health issue has to have a high burden. Pain is the number one symptom for which people seek medical care worldwide, but the burden of pain extends to other types of chronic pain, as well as to acute pain and cancer-related pain. In addition, it should have an element of prevention. Think of vaccines to prevent disease, or food supplements to prevent vitamin deficiency, or even educational campaigns to decrease risky behavior associated with smoking or HIV transmission. In the area of pain control, we are very fortunate to be living in an exciting time when efforts that target acute pain, such as around the time of an operation, now hold the prospect of decreasing the risk that acute pain will evolve into chronic pain. Public health problems also have a very important other dimension, and that is the social justice dimension. This has been influenced by the World Health Organization definition of health, which is not simply the absence of disease, but also that a person gets to live up to his or her full potential. On the other hand, we know there are inequities in healthcare and certainly in pain assessment and treatment. There are hierarchies, and the WHO and UN have written about the social hierarchies that perpetuate inequities. These include low socioeconomic status, that's a risk factor not simply for many other diseases, but in particular for pain. We want to also recognize that patients with pain are stigmatized. This is part of the hierarchy of social exclusion. There are many patients who are being caught up in appropriate and much-needed efforts to control substance abuse in society at large, who are now finding it harder and harder to receive appropriate long-term prescriptions of their pain medicine. To the many who suffer from pain, and the wonderful people, including AAPM members who care for them, I want to tell you first that you have nothing to be ashamed about if you're in pain, and second, that AAPM cares about you and your pain. Thank you. AAPM is the voice of pain medicine. We are dedicated to relieving pain.